recording right now. So hello everyone, my name is Jennifer Metch. I am the tech host and welcome person for Santa Clara County Office of Education. And you are here for the School Linked Services workshops. I know someone asked about some other title in the chat. So if you feel like you're not in the right workshop, just go back to the main room and have them send you to a different one. But we hope you stay because this is great information. So School Link Services provides students, children, and families with school-based coordinated services to address needs and well-being gaps of families through a community participatory approach. School Link service coordinators located at the school district or a school site develop partnerships with schools, public agencies, and community-based organizations in Santa Clara County to improve protective factors. An example is family relationships, decrease risk factors, which would be behavioral and emotional problems, and enhance service accessibility and resource linkage, and to support children's success in school and in life. So we have two presenters today. The first presenter is Catherine Aspiras, and she's been with the Santa Clara County Behavioral Health Services Department Family and Outreach Division for 18 months. She's currently working on increasing awareness and outreach to identify youth and young adults with early signs of psychosis and establish linkage to services to prevent or delay the onset of psychosis. Catherine is overseeing family engagement and service coordination at 15 School Link Service School, let's say that 10 times fast, sorry, school districts and school-based behavioral health services by 7 community-based providers, in addition to collaborative projects with Santa Clara County Office of Education and integrated projects. She is supporting the implementation of youth drop-in centers in partnership with Stanford University and Alum Rock Counseling Center. Catherine received her master's degree in counseling psychology from the University of San Francisco and her bachelor's degree in sociology from California State University, East Bay. We also have Isaac Gutierrez, who was born and raised in East San Jose, California. He graduated from San Jose State University with a master's in social work and began working for Santa Clara County Department of Substance Use Treatment Services. He has over 12 years experience working with adolescents with co-occurring disorders. During his 12 years of experience, he has worked with youth in Santa Clara County's juvenile hall and a specialized drug and mental health court. As a licensed clinical social worker, he provides substance use treatment to local clinics and high schools, educating and treating substance use through family, individual, and group therapy. So welcome to both of you.
Thank you. Thank you so much for the introduction. And I am Catherine Aspiras. I'm the program manager for School Link Services and the School Link Services Initiative. And I'll be sharing today about School Link Services. And my co-presenter, Isaac Gutierrez, will also be sharing about the Youth Substance Use Treatment Services, also known as YSOC. And both of these services are at school districts, and we will identify what school districts those are. We will be talking a little bit about our Children, Youth, and Family Division with Behavioral Health Services, the School Link Services Initiative, and the School Link Services Initiative districts. We'll talk about the impact of COVID-19 on School Link Services, and we'll go into more about the substance use treatment services and provide information on how to access and resources for School Link Services and the substance use treatment services. We will also have time at the end for questions and answers. So this is our children, youth, and transition age family system of care within Santa Clara County Behavioral Health Services. And our Santa Clara County Behavioral Health Services Department has an array of services going from the least intensive, so which is the programs on your left, all the way to the programs on your right, which is the most intensive. So we provide services based on the needs of the student and the families, as well as within the different categories of services. It also accounts for different types of services provided to the student, to the family, as well as the number of hours served or provided to the family. So our prevention and early intervention program, which is about 1 to 4 hours per month for a student or a family, this is your most least intensive program. So this is a program that provides early intervention, prevention. We provide services at schools like skill streaming. We provide group therapy. We also provide psychoeducation. We provide information about engaging students and family engagement activities at schools. And then we also provide services for early signs of psychosis. And then the second category, called outpatient, is 4 to 7 hours per month that's provided to a student and to their families. And this is your traditional therapy that is provided. It's one-to-one therapy or also family therapy. And we have services at schools, or they provide them in the community or in the home. And they provide ethnic specific outpatient. We provide services for kids 0 to 5. And we also provide services for our transitional age youth, which is from 16 to 25. Our middle category is called intensive outpatient, and the hours of service here is greater. So we provide 8 to 14 hours of service per month for the youth and family. And these services include possibly some team approach. There may be a behavioral health specialist that will work with the youth. There will also be possibly a family partner that will help the family, the caregiver, the parent get linked to services. So there is a team of people that can support the family. And then the program on to the right is our intensive wraparound. This is our hours of services, 15 hours per month on average. And this is a team-based approach. So you have possibly an occupational therapist on the team, a psychiatrist, the case manager, a therapist, a behavior therapist. So all of the supports and services are wrapping the family with services in the community and in their home to prevent the youth from escalating into a higher level or going into a higher level of care, and also to keep the youth remaining in the home. And then our highest level of treatment services is our residential treatment. That is a substance use residential treatment services and a short-term residential therapeutic program. Along all of the different services that are provided here, we do provide what we call on this bottom bar therapeutic behavioral services, which is a 90-day program that can really support the student or the youth who have a specific behavior that we need to address to. So something along the lines of possibly a youth is running away from home. We want to really provide a team approach and support the youth with reducing that behavior. Lastly, across all of the programs, we have a crisis services programs. And this includes a mobile crisis. It also includes a crisis stabilization unit and a community transition service. So if a youth is having a psychiatric emergency or is in crisis, they may be harming themselves, they may be really unable to be controlled, and they're wanting to hurt other people. We request that you call the mobile crisis, and the mobile crisis will assess the situation and possibly come out for services. If needed, instead of having a youth go to a hospital setting, they may transport the youth to a crisis stabilization unit, which is a 23-hour and 59-minute hold. And so that hold is at a program in Campbell, and they really try to help the youth in stabilizing them. And once they're stabilized, they could then provide behavioral health services and then refer them to long-term behavioral health services. So today we'll be focusing on our school-based programs, and that's primarily in our prevention and early intervention, and also our outpatient services here. So our prevention and early intervention programs that are at schools is called the Schooling Services Family Engagement Program, the Prevention and Early Intervention Behavioral Health Program, and the Schooling Services Behavioral Health Program. We also have our substance use treatment services here that is also available at schools. I want to share with you a little bit about schooling services and the history of schooling services. So in November 2004, California voters passed Proposition 63, the Mental Health Services Act, also known as MHSA. And MHSA provides a 1% tax on taxable personal income over $1 million. The MHSA tax revenues are distributed among the California counties by the State of Department of Mental Health. And MHSA calls for a transformed mental health system where access is easier, services are more effective, and out-of-home and institutional care is reduced. We also are working on the stigma towards reducing the stigma towards the severely mentally ill, and also providing prevention and early intervention services. So through MHSA, California counties are able to work with stakeholders and programs and agencies to provide behavioral health services to prevent the prevent and provide early intervention. So we have been this program, or the programs that are supported under MHSA, really hone into the supports of behavioral health and emotional well-being. So schooling services mission and vision is that the vision is to provide by serving the needs of child and family through coordinated integrated approaches on school campuses. SLS, which is also known as schooling services, will create equitable opportunities within schools and communities. And our mission is really to improve the accessibility and efficiency and outcomes of multi-agency services. So we want to ensure that we can increase access to services. We want to also make sure that these programs are efficient and that we are demonstrating outcomes and improved outcomes when they are receiving services. So schooling services was established in 2011. This was the Board of Supervisor Dave Cortese had called for the county departments to develop a plan to implement schooling services across Santa Clara County. And how we determined the different school districts was based on a high area risk map. We looked at several factors such as poverty, substance abuse, child removals, juvenile justice entries, mental health consumers, school dropouts, single parent households, felony arrests, teen mothers, and low statewide test scores, as well as low birth weight by zip code. And once we found the high risk areas, we then established what schools we will be providing services at through our school-based schooling services. And so in most of our school districts that I will share, there are specific schools that we are at, and then we are providing an array of services at these school districts. The SLS initiative has 4 essential elements. That is service coordination, which allows for services to be coordinated at school. We have a SLS coordinator that can link parents and youth to specific services and based on the needs of the family. We also have another essential element is family engagement. These include activities and workshops that help the student and the families feel welcomed and safe at schools. And so some of the activities they have is possibly a back to school night event, maybe a screening of a movie, such as there was a screening a couple weeks ago called Angst, which is an anxiety movie. We also provide family engagement activities for parents, like workshops that in which they can learn more about how they can be part of the school system and support their students, their youth's academic success. We also have groups for parents, such as strengthening families, and that allows to build a family system, and even they work on eating dinner together at home. We have another essential element is the campus collaborative. That allows for a group of stakeholders, includes parents, students' voice, as well as providers and faculty administration to talk about the needs of the schools and the communities, which then informs how and what type of family engagement activities will be created during the school year. And then lastly, our last essential element for SLS is the co-investment. All of the school districts that are participating in schooling services co-invest resources, their budget to this initiative. They are partners in this collaboration, and we have been working with school districts to really flourish the SLS initiative within their school district. A little bit about the SLS organization. So if you look here, we have the schooling services as initiative as the entire umbrella. We provide universal prevention. So this is accessible to all youth. Prevention and early intervention activities such as in the class, they may have skills streaming. There may be coping strategies learned, groups provided. We provide SLS family engagement. Those are the activities I had shared. And then And at Alum Rock Unified School District, there is an educational counselor at each of the schools. We then provide targeted early intervention. So this is our prevention and early intervention program. This is also a program that is going to be implemented in the early next year called Alcove. It's a youth drop-in center. We have intensive intervention services here. This is our school-based behavioral health services, which provides therapy at schools, provides one-to-one therapy or even family therapy, and we have the different programs listed here. We have projects under the Schooling Services Initiative that we are working with the County Office of Education. We do a robust data and evaluation for all of our programs and projects. And then we are also integrating schooling services in different projects across the county. The Schooling Services Initiative has 3 different components. Primarily, the family engagement is the first component, and this provides a referral and linkage and triage for families and students. A youth may come in to meet with the SLS coordinator, who then shares they are looking for support for their academics or tutoring. That SLS coordinator will link them to their appropriate requests of services. We also provide here, like I mentioned, one-time events. So those are the different events to help engage families to come onto the school campuses, to hear about other resources, as well as to welcome families onto school campuses. They are doing virtual events right now due to the pandemic, but then will resume in person when the opening is happening at the schools. We have family engagement at 15 school districts. There's 29 coordinators across Santa Clara County that supports the family engagement activities, and they serve about 10,000 students and families annually. Our next program is the prevention and early intervention. This is more of our group supports. As I mentioned, we provide skill streaming in the classroom, therapeutic groups, parenting groups. More recently, we have been providing services to teachers at school districts, and then also to parents at the schools as they are experiencing a lot of stress during the pandemic. We are at 11 school districts across 8 providers, and we serve about 2,000 students annually. And then our most intensive program under schooling services is our SLS behavioral health program. This is your outpatient services that includes individual therapy, case management, and we also have psychiatry and medication support in this program. We are at 13 school districts across 7 providers, and we serve about 750 students annually. Here are the different school districts that we are at school within schooling services. So you see here, there's a map of all the different schools that we're at and school districts. We are at Mountain View Wisman, Eastside Union High School District, Mount Pleasant Elementary School District, Mountain View Los Altos, Evergreen, Oak Grove, Alum Rock Unified School District, Franklin, McKinley, Luther Burbank, Milpitas, Morgan Hill, Orchard, Fremont Union High School District, Campbell Union High School District, Gilroy Unified, Campbell Unified, and San Jose Unified School District. So we are across these school districts, and we have different services at each school. When you see the little icons here, that means that we have all of the services at the school. So like Mountain View Wisman has the family engagement, PEI, and SLS services. As I mentioned, we have other programs and projects within schooling services. We are currently working with the County Office of Education regarding a mental health student services grant we received. And this grant has priorities that include creating wellness centers at schools, increasing mental health professionals at school sites, and implementing and adapting professional learning. We are also working on a feasibility report for a Board of Supervisors, Susan Ellenberg, to look at how to plan and provide behavioral health services for all youth in all Santa Clara County school districts and schools. We have a program that's going to be implemented in the early next year called Alcove. This is an integrated youth center in partnership with Stanford University and Alum Rock Counseling Center. We will serve youth 12 to 25. We have an array of services, and this program will be servicing youth regardless of their insurance. So we can serve youth with both Medi-Cal beneficiaries as well as private insurance. We have a program and a project for clinical high risk for psychosis. So that's really raising awareness on early warning signs of psychosis and to better identify and quickly connect at-risk youth and young adults. We have, I mentioned the Alum Rock Expansion Program. This has academic interns at Alum Rock Unified School District at each of their schools. And then we have 2 additional programs called Unconditional Education, that's at Rosemary Elementary and Fremont High School. And then we have the SEAS program that's also at 3 charter schools in the Evergreen area. Some of the impacts on the impact of COVID-19 on schooling services. These are the 3 areas of impact: access, needs, and challenges. In terms of access, we have been allowing SLS coordinators and school-based behavioral health services providers have been providing in-person services and virtual services based on the needs of the family. So they are working remotely, but they have, if needed, gone into meeting with the families in person. SLS coordinators utilize their existing relationships with parents prior to COVID to continue checking in with families. So it's youth that have may been difficult to reach, the SLS coordinators who have met with them before have been connecting with them throughout the pandemic. SLS school districts transitioned to an online referral. So some school districts like Gilroy and Alum Rock, they have been changing to an online referral system so that parents can also refer their child or request for services or identify some needs that they have, and they can do that online. We've expanded services to provide drop-in services for students and for parents and for faculty to help gather some information and see what resources are available, and also to help them de-stress during this pandemic. It's been a very stressful time for parents and for faculty as well as for students. And so drop-in services are available at school sites where they can meet with a counselor and then they can be referred possibly to a program. And so like I said and mentioned, we had expanded supports and services to parents and teachers. Some of the needs that have been identified during this pandemic has been more on the basic needs, such as food and shelter, also implementing distance learning and providing digital devices. We saw in the beginning of the pandemic that there was a decrease in referrals to behavioral health because they were more needing to attend to their basic needs and to implement the distance learning in their home. So we have seen also an increase in crisis calls prior to schools resuming in the fall, and that has been leveling out the same way as previous years. So we are still seeing crisis calls coming in. We have seen an increase in behavioral health referrals starting in the beginning of the school year now, that students may be having difficulties with adjusting to the environment, and so behavioral health has been provided to those students. We saw that the needs of parents and teachers has increased. We also saw the need from parents to create a routine and a home and create a routine in their home and an environment in their home for distance learning. Another need that parents had shared was the need for non-screen time activities. There has been a discussion, the parents have shared that there has been a lot of their family, their students and their youth having virtual fatigue. And then training on the use of digital devices and platforms have been also a need for parents. Learning how to utilize Zoom or their Google Meets has been a need. Some of the challenges that we have, such as virtual fatigue, we saw that scheduling therapy sessions was difficult as well. Students were not really wanting to be on the therapy session virtually for long periods of time. So we actually, instead of having like a 50-minute session, we decreased it to possibly a 30-minute session and then increased it twice a week to check in with the students and the families. There has been challenges of isolation with families, with students, even connecting with parents remotely. Another challenge that we've seen is the increase in behavioral health, behavioral and emotional needs, and the trauma that it faced by different age groups. And I'll share with you a little bit about what you may be seeing with youth and students during this time. So behavioral and emotional responses to trauma and this COVID-19 pandemic by age varies. We see a lot of different responses by the age groups. So for preschool and young school age youth, We have seen their emotional response during the pandemic to be seen as helplessness, uncertainty, and general fear. Some of their behavioral responses is difficulty separating from their parents, possibly some loss of speech and toileting skills, sleep disturbances, and then repetitive or less imaginative forms of play. With school age youth, so those are youth probably about 6 to 15 or so, their emotional response is feeling overwhelmed by feelings of fear or sadness, anxiousness, persistent concerns over their own safety and safety of others. Some of the behavioral responses are similar to the young children of sleep disturbances, difficulty concentrating and learning at school. They may also have some physical complaints of headaches and stomach aches. And then you may also be seeing some unusual, reckless, and aggressive behaviors. Children this age also retelling of a lot of their stories to others is also a response to trauma. And then lastly, for adolescents, so this is youth 15 to 16 and older, their emotional responses have shown feelings of fear, vulnerability, concerns about being different and withdrawn. Also, self-consciousness has been emotional response in this event. And then behaviorally, possibly some self-destructive behaviors or accident-prone behaviors. And these are behaviors that possibly we're not seeing prior to COVID, and more as we're continuously being in this pandemic, they are showing these type of behavior and emotional responses. When seeing these with students and your children, it's really important to connect to a provider to see if there's maybe support that can be provided to the youth to address some of these areas of concern. And so my co-presenter, Isaac, will start sharing about substance use treatment and substance use.
Thank you, Catherine. Appreciate it. A lot of good information there. And it kind of blends into what I'm going to present also, just about all the services and youth in general. So on this first slide, as you can read, addiction is real. And I think everybody can just read this slide, but I want to kind of explain a little bit of it also, is that with youth, addiction is different. Like it's kind of like the mental health issues, right? So I deal with a lot with the co-occurring, meaning mental health and substance use. Co-occurring in adults, you can see it really good. I mean, it's present, it's there. You don't have to worry about their development. But with youth, you really have to worry about their development. It's a lot of times, and this is just my years of experience working in juvenile hall and the 12 years that I've been doing drug and alcohol, is kids, and we'll talk about this a little bit more, is that they need a lot of, that saying, it takes a village to raise a child, right? It's true. They need a lot of different people involved in their lives to kind of receive help. So addiction can mean, it can mean, a really bad habit, right? Or it could mean really they're starting to form habits, really bad habits that will form addiction in the future. So it's addiction is it's very important to understand too, because it is a disease, it is a brain disease, and it gets frustrating. It's a disease of choice. So when you think about it in that way, they have a hard time deciding, to make better choices because they're just choosing one thing all the time. And because their brains are so young, it's rewiring their brain to think, hey, I like this substance, it makes me feel good. It makes me feel secure, right? Because a lot of teens want to figure out themselves. So it makes me feel secure, it's great, makes me feel popular. I can hang out with these people that are popular, that are using. So there's a lot of things that go into it when we're talking about youth. Adults, way different. So Catherine, I was going to say, should I share my screen to go, or should I just say next slide? Okay.
Next slide's fine.
Okay, thank you. So next slide. Okay, so this is a fancy PowerPoint where it just kind of goes into the picture. But as you know, we'll just talk about the brain just a little bit, just so we get a better idea. And I think education is power all the time. we get a better idea, especially if you're parents, you're really concerned about your child, or you're a teacher and you're concerned about or whatever, somebody in the community. But it's just important because this is what drugs do, right? Sometimes, in the beginning, and if you can think about it, just personalize it too. If you can think about caffeine, just other things in your life, food also, where it triggers those endorphins and in your brain, right? To start thinking, and this is, I know I'm comparing apples to oranges too, because this is drugs that really make you feel better. It really does. So all these, your brain is kind of rewiring to decide, well, I'm going to use drugs more, and it's not going to be voluntary anymore. It's going to be, you just go straight there. When I'm sad, when I'm happy, when I'm, excited. So there's a lot of emotions that just rewiring to the drug, and that's all. So like I was saying, it takes a village, because when we get those habits going, right, especially with the youth, with football, community, people in their realm, their social realm that they can actually relate to, that get the natural endorphins, the natural drugs going in their head, then there's something to work with. I get a lot of youth that just say, I'm really good at smoking. That's what, and we don't want to hear that. We want to have an array of things that they're good at. So, all right, next slide. Thank you. So again, this is kind of reiterating, it's more brain information, but we can kind of read what's going on here. But I just, and I kind of explained it too, but if you, well, you kind of can't read this, but when you're thinking about a youth brain, right, it's not fully developed till 25. So it's very, very important that you get them involved. I think hobbies really get them to start feeling it. First, it helps them with their self-esteem. So they're, they're feeling better about themselves, right? And they're doing things that make them happy, naturally happy. So we see the free frontal cortex here. So that is the part of the brain that you have to understand, and this is essential for me as a therapist also to know that these kids, you give them instructions, they don't know how to follow, and they're about here and now, right? They're about what's going on right now. They're about social pressure, and they're disorganized at this age. So if we have those expectations for them to kind of be a little bit more like an adult, remember important dates, be organized, it's not gonna work well. So just being patient with, because the adolescent brain is still growing, right? Like we would not get upset at a 1-year-old for trying to walk. It's the same thing with an adolescent. So they're going to be rebellious, and the reason why they're rebellious is they want to find their own. They want to be independent. So it's fine. It's their developmental stage. So a lot of this is just them developing into an adult. They're not an adult yet. And I know a lot of times we think, hey, they're big, their voice is changing, but their brain is still not developed. And that's one thing we can't see. I mean, maybe if we could see it, like if it wasn't developed all the way, then we have more compassion, but we can't see it, and they're not developed fully. So I think this is a good image to kind of for us to have a little bit more compassion for an adolescent. Cool. So why are youth using? And I kind of explained this a little bit, but this is, again, it's developmental. We have to remember, just to be more empathetic, if you remember right now a time when you're an adolescent and you did something that was just, you're surprised that it all worked out, that you're here, it's natural, right? I mean, there's examples of that in my life that I'm like, wow, I can't believe I did that as a teen. Now as I'm an adult, I know that I won't even get near to that. So you do a lot of things to feel cool because you're a teen, because that's your development, that's appropriate. So a lot of it too, there's a lot of peer pressure. And so that's a huge part of it. Depression, anxiety, I mean, when you use that, it gets rid of all that stuff. And it's important for them to know that that happens. Like, use drugs do something for you and it makes you feel good. But you're gonna have to understand the negative part of it too, because there is negatives. There's positives and negatives, especially when you do it a lot. So it's good to kind of talk about. And use is normalized. So especially with youth, think about it, normalized in a way that they feel like, they see parents, they see family members drinking alcohol, whatever it is, and they're like, it's fun. I never see my uncle so happy until he drinks alcohol. So it's they're learning by visually seeing it. So commonly used drugs in the county of Santa Clara. If we look at this picture right here, there are several items in here that you might think, well, as you're emptying out your child's backpack or whatever, that these are innocent. I mean, they look innocent, but they're not. They're actually tobacco, or they have marijuana in it. So it's important to educate yourself about what they're using. So that's what I'm going to do with these next slides. So this is what's going on now. So Jules, I know there's a lot of commercials on radio, on TV. So teens, as you know, they're into fad. Things are changing. Even tobacco, I mean, even the big tobacco, they're changing things, right? Unfortunately, to benefit minors. So they have, great flavors for them. So now Puff Bars are out. Juuls are out. Puff Bars are in. So Puff Bar is that one that looks like a USB port right here. Yeah, that, and then a little over too. Yeah, right there. So that's a Puff Bar, and I've heard from kids it tastes like pure strawberry. It has all these great tastes, but it's pure nicotine too. So we'll talk a little bit more about this. And the other ones are a little bit old school. So the one where the cursor is at right now, that is for marijuana, for wax, and that's a high concentrate of THC. So it's just, they're making all these devices, and if you can't keep up, then they hide the actual what they are. So and it just takes one puff to have, I'm going to say, the old school way, right? Just like having 2 or 3 joints. So one puff would equal that amount. So and it doesn't smell, so it's very convenient. Yeah. So the next slide. This is kind of what's going on, and the language has changed, right? So it's not jeweler, it's like Puff Bars now. So if you look at it, this is what's happening in high schools. A lot of kids complain, even the ones that are like, hey man, I have to be sober because I'm on probation and everybody's smoking in the bathroom. That's what's happening. So I spent a lot of time at Lincoln High School, and a lot of the kids come in complaining that they're in this hot box really in the bathroom. So a lot of them, that's what they're doing in the bathrooms, is smoking. So it's unfortunate, but this is where all the peer pressure comes. They're there, they're meeting up, they're texting each other, hey, let's meet in the bathroom, and that's what's happening. So if we look at this can compare also to marijuana. So I want us to kind of be a little bit more visual of this too, and maybe I should have changed it up so we can see all the effects. So equals 20 cigarettes. So 1 pack of cigarettes you see there. So that's like a pod. So a pod is it's kind of like a liquid form of nicotine, and they put it in those little cartridges and they smoke it. So a whole pod is equal to 20 cigarettes. So if you can click, Catherine, I think it shows it. So it's amazing how many cigarettes. So the old school and right, you look at that stuff, you look at all of the cigarettes they're actually smoking in a couple of puffs, and it's amazing. They're getting so much nicotine, and this is true with marijuana too. They're getting a high dosage of marijuana and nicotine with those puffs, with those vape pens. It's alarming. So a lot of them are going to go through withdrawals, right? So there's going to be a lot of withdrawals with that. Headaches, can't sleep. It's going to be more difficult than it was in the past because these instruments to use are more readily available, and they're also disposable. You buy them for $5, like that puff bar. You buy it for $5. You know, you have a certain amount of puffs and you throw it away. So it's very disposable. They buy it, tastes, like grape or strawberry, whatever it is, and they inhale so much nicotine. So next slide. Okay, so I kind of went over this too, and I'm going to kind of speed it up so we have room for questions. But so nicotine withdrawal, obviously having cravings, these are all the withdrawals, and it's similar to marijuana. So this is a lot of things that are happening with marijuana, especially because of the high intensity of what they're taking now. So this is huge right now, Xanax. This is just for pure education. These are what they're taking on the streets. The different colors equal, how powerful they are, really. So these are the names on the streets. Green Hulks, this is what they talk about. Yellow school bus, white ladders, tablets. So it's important to know their language too. So Xanax, and this is kind of what was related to the last slide, but it comes in all shapes and colors. This is very common in Santa Clara right now. They're mixing it with Gatorade and Sprite, which can be, you don't even know what they're intaking, right? So they have a Gatorade and you think it's innocent, but it has a Xanax pill in it. So very important to know how they're consuming these pills. This has been an epidemic here in Santa Clara County. The epidemic is fentanyl, and fentanyl is being mixed. Fentanyl is a drug, very powerful drug that's being mixed with different pills. So very important. All right, next. So this is also another drug that's out there that's new. So Percocets, they call it Perkies, blue M30s, that's what's on the streets. So last 2 years has been very popular, and it's mixed with fentanyl. And it's we have a thing called the opiate grant with Santa Clara County, and it's killed a lot of kids from age 14 to 25. There's been about 20 deaths so far. And this was information as of May. So this is huge. I don't know if you saw it in the news. So watch out for pills. Kids using pills, it's very dangerous. They never know what they're going to buy. So I kind of explained this too, and it's not the same. So yeah, this fentanyl, it's they call it Fetty. It's cheaper, right? Because it's a man-made. Well, it's actually really strong as far as you see there. Just a little bit of it can be lethal. So important to know that and be educated about that. And just with kids, I think it's important to kind of give them that information too, so they know what they're taking. Again, like I was saying, there's like old school smoking of marijuana, right? That's the blunts and joints. Why is it old school now? Because you can smell it. It takes longer to get high. And so it's when I hear it, it's funny because I'm seeing a lot of these younger teens, and they're like, oh, the old school, smoking, we don't do that anymore. It's just the wax, the instant, right? You just one puff and you're good. It's changing. You have to keep up with the times to understand the THC level. So So this is exactly what's going on here. I mean, the levels, you just read it, the levels are really high. You know that it's getting dangerous, right? The addiction part too, and the studies aren't all out either. So, I mean, we know that 2020, it's about 100% THC. So this is really, I mean, the withdrawals, I've never seen them this high. The withdrawals are ridiculous. So very important to kind of check that out or just be informed. This is all this, you know, stuff that we know about withdrawals. Yeah. And then as far as schizophrenia goes, would be amazing. You know, I mean, when we think about it, we're like, hey, how does marijuana use impact schizophrenia? Well, 46% of marijuana users develop schizophrenia. So it's not, I mean, we think it's meth, but it's marijuana now because of the high content. This is also, you can just see it real quick. I'm going to try to kind of speed through this. So if there's any questions, but stimulant, obviously, yeah. This is how we work with our clients through the stages of change. They might not think they have a problem. And this is how we, you know, this is what we do in treatment. Obviously, honesty is first. Meet them where they're at. Therapist, you know, is that catalyst for change. So we use the harm reduction method. Yeah.
So we do have just about a minute left. We do have the PowerPoint presentation will be available to share with everybody, and it includes there also how to receive services and how to connect with behavioral health or substance use treatment. We are at different schools, as I mentioned earlier, and substance use treatment services are also at schools, but we can be reached through our behavioral health call center or through the schooling services coordinator. And we will share all of the slides with everybody who's joined here today, as well as those that with all of the audiences that attended today's workshop.